The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
They were introduced less than 6 months ago, and tonight, vaccine passports are no longer mandatory in Ontario. And as a range of other restrictions have already come off, tonight we'll get some advice on how to deal with reopening anxiety and how to assess your COVID-19 risks. Also, with almost 2 years of hindsight available, we're asking, did the big public health institutions fail us at the outset of this pandemic? It's Tuesday, March the 1st, and that's next on The Agenda. Some people cannot wait for all COVID-19 restrictions to be lifted. Others say it's much too soon. But wherever you fall on that spectrum, the province has opted to end vaccine passports and is already signaling that mask mandates could be next. Here for their advice on coping with a new normal and how to assess your risks, let's welcome, in Mississauga, Ontario, Hayley Hamilton, Senior Scientist at the Centre for Addiction and Mental Health and the co-leader of CAMH's COVID-19 National Survey Dashboard. In the East End of the provincial capital, Rewat Deonandan, epidemiologist and associate professor at the University of Ottawa's Faculty of Health Sciences. And in Scarborough, Ontario, Steve Jordens, professor of psychology at the University of Toronto, Scarborough. And it's good to have all three of you on our program. Steve and Rewat again, and Hayley, I think, for the first time. So we're delighted to welcome you aboard. The Chief Medical Officer of Health for the province of Ontario is a guy named Dr. Kieran Moore, and here's what he had to say about our subject tonight. Sheldon, if you would.
In the face of Omicron, I absolutely think we have to start to understand, we have to learn to live with this virus. And we've let our lives be controlled for the last 2 years in a significant amount of fear. And now we're going to have to change some of that thinking.
We have to learn to live with that virus. Let's get into that. Hayley, what do you think? Are we ready?
I think a lot of people are ready, as you indicated. We've been going through this for 2 years. People are tired, and they would like to return to some semblance of order. So I think people are ready. Many of them are, some not quite so much. And those individuals will proceed at their own pace. But I think, given the experiences over the last 2 years, yes, I think in a sense people are ready to start the process of reopening and getting their lives back.
Rewat, what's your sense of it?
Well, are people ready? Psychologically, many are, some aren't. The problem, from my perspective, is that what we're essentially hearing is that we're downloading the responsibility for pandemic management from the state onto the individual, and not every individual is as equally equipped to deal with this as others are. I'm thinking about low-income people, people who live in multi-generational housing, people with small children like myself who aren't vaccinated, immunocompromised people. I'm hoping that the government maintains some level of support to make sure that those individuals who need that help receive it.
Just to be clear, because the syntax may not have been there, you are vaccinated, it's the kids who are not vaccinated. Is that what you were saying?
That is correct. Kids under 5 are not yet eligible for vaccination. So if you have one, you are a little more trepidatious about re-entering the world than others.
Gotcha. Okay. Steve, your sense of where society's at on this?
Yeah, I mean, we're exhausted. We've been dealing with chronic stress for a long, long time. We know that when we do try to deal with a chronic stressor for this long, we eventually reach a period of exhaustion, and I think we're there. So I think the whole notion of sort of rationally looking at risk and all this stuff is very difficult for a lot of us right now. And emotionally, we just want our lives back. And so I think there is a hunger to get back out there. And I think we will see what I've been calling the great snapback, where for most people, they will be back to that way of living very quickly.
Did I hear that right? The great snapback? Is that what you're calling it?
The great snapback, yeah, which is just a function of the fact that we are social creatures. I mean, the way we behaved before was our natural way, and we had habits that we developed for decades. As soon as we get back into those contexts, those habits will be triggered, and I predict most of us will feel really good. We'll be a little anxious going into it, but before long we'll feel, warm blanket of familiarity.
You better trademark that, my friend. That's a good expression. That one's memorable. Okay, I want to get a little personal with each of you here. And Hayley, again, I'll start with you. We suggested in the introduction that there is a continuum here, and you've all echoed that as well. Some people raring to go, other people really quite nervous about the whole thing. How about you, Haley, personally? Where are you on that spectrum?
I'm ready, but also cautious. So I'm one of those that, given the last years and all we've had to endure, I am ready to proceed, but I will be proceeding in a cautious manner. And I think it's important for everyone to remember that people will proceed at their own pace, and that may be different for each individual, and it's up to each individual to determine what works for them, and to assess where they are and what risk might be associated with activities that they are willing to engage in at any given time. And so quickly they proceed to being ready to dive in fully. That might differ for individuals. For me, I'm ready, but I'll do so and proceed cautiously, take risks into consideration.
Okay. Ray-Watt, how about you?
I'm desperately eager to reclaim my social life, desperately. However, I can't, because as noted, I have a child under 5 who can't be vaccinated. And so I have to curtail my exposures for the next few months at least until we get him vaccinated. So again, for a lot of people, they might want to, but they can't for responsible reasons. And others may choose differently. They may choose to allow those individuals who are protecting to become exposed, but I have to choose otherwise.
You're going to teach a class immediately after we're done with you here today. And my question is, are you ready to go back into a class with students who are maskless?
I'm not. I've actually arranged it so I don't have to do that for another year. So I've arranged all my online teaching to make that happen. Not every professor or teacher has that luxury. But I'm not too ready to go back in that situation simply because, again, I have someone I need to protect, as many people do. If it's just me, totally ready. Totally. 3 doses, triple dose, healthy guy. My risk, my individual risk of having a bad outcome is quite small, as it always has been. This has never been about individual risk. It's about the risk to the population and the risk to certain people in your social circles.
Steve, how about you? Where are you on that continuum we talked about earlier?
I'm eager. I'm ready. But I do want to highlight with this point that we can talk about it as a continuum, but there's an important point at one end of the continuum, which is some people have felt real fear, real existential fear during this. Most of us just have felt annoyance and frustration. If somebody felt like this virus might kill them or might kill somebody in their family, when that happens, it activates primitive parts of the brain, the same parts of the brain that give rise to things like PTSD. And so that part of the brain can emotionally connect certain stimuli like crowds or maskless people with this fear response. And so while most of us, it's just going to be this uncomfortable transition, we have to remember that there are some out there that are going to find it really, really difficult, and in fact may need some professional help to deal with the stressors they feel when they try to reemerge.
I am going to come back to that a little later in our conversation. But Ray-Watt, let me follow up with you on this. And as much as this is going to sound like a cynical question, it genuinely is not. We're fewer than 100 days away from the next Ontario election. And we know that the government of Ontario feels its re-election chances would be better if people think things are getting back to normal. So my question for you is, why do you think we're taking this step right now, as opposed to when the numbers, the closer we get to the summer, would really start to crater in terms of hospital admissions, et cetera? How much science, how much political science do you think is behind where we're at right now?
A delicately phrased question, Steve. I applaud you for that. I don't have the expertise to answer it in a fulsome manner. However, clearly, there is a political component to this. The timing is not based on the science. The timing is based on political expediency. These lifting of restrictions should never be tied to calendar dates. They should be tied to objective population-based indicators. And we're talking about this as we're coming off a fairly large wave. We're not done the wave yet. The hospitals are still experiencing traffic that is untoward. We're looking at an increased level of death still. We're plateauing at a high level. The indicators suggest now is probably not the best time to lift all restrictions wholesale. So this is based on other factors, economic, psychological, and probably political.
Okay, that question of mine, you feel, may have been delicately put, but that answer was not delicately put. You came out with full steam ahead on that one. So you're not a political scientist, but you're content to say that there's some politics that has gone into this decision.
I think I'd be foolish not to accept that strong probability. And that's been the case for the entirety of this pandemic, is the decision-making has not been driven solely by the public health science. I'm fond of saying that public health is the art of the possible, which is like diplomacy is supposed to be as well. Mm-hmm. And the possible is gated by political will and by public tolerance. Will the public tolerate more hardcore restrictions for many more months? Will the political sphere tolerate it? Probably not. So we're limited to what we can do. What we can do is download responsibility onto the individuals to an accelerated pace.
Emma Teitel is a columnist with the Toronto Star. She wrote about this past weekend, and I want to read an excerpt from her piece and then get folks there to comment. The government restrictions that the unvaccinated cite as evidence that their freedom is being curtailed have been a means to freedom for the vaccinated majority and a means of stability for the businesses and cultural institutions they frequent. The same goes for masking, a practice loathed by some but widely accepted by most of us. A practice that, like vaccine passports, our provincial leaders are hinting at scrapping in future months. Thus, Toronto finds itself in yet another unsettling transitional moment in an era full of them. Clearly, the provincial government believes Ontario is ready to, quote, live with COVID-19. A recent Leger survey suggests that nearly 30% of Canadians are ready to live with it. Are Torontonians. Let me just add to what Emma said by saying, okay, Leger's at 30%. Angus Reid had a survey out saying 54% were ready for the pandemic to end. That still leaves anywhere from 45 to 70% of people who say they're not ready yet. Okay, Hayley, for them, what do the next few months portend?
I think caution and a little bit of trepidation, a little bit of anxiety, because they're trying to return to a pre-pandemic routine in some way. And I think we have to be mindful of our experiences over the last 2 years and recognize that it's been a bit of an upheaval. There have been waves of COVID, high numbers, cases decline, there's optimism and people out there, then they're pulled back, then they go back out there again, they're pulled back. So there's just a lot of changes that individuals have had to endure. So I think that, yes, it's perfectly acceptable and reasonable that some people would be wary at the moment. And especially given what happened in December, where so many were disappointed with the changes that had to be made, many people's plans of holidays, still with people, still in people's minds. So I think it's perfectly reasonable to expect that some people would be very, very cautious, very wary of just proceeding.
Well, I'm going to give Steve an example of something that I suspect is absolutely going to happen in workplaces as we go forward. And I want you, Steve, if you would, to give us some advice on perhaps how we should handle this. You know that people are going to be coming back into the office in larger numbers. They are going to be meeting closer together, not as physically distant as they once did. And I'm sure at some point somebody's going to say, look, we don't need these masks. Hey, John, Sally, take your masks off. We don't really need this anymore. That's the scenario. How do we handle that?
Yeah, I mean, it's a very likely scenario because those are contexts where we have habits that don't include wearing masks and don't include whatever. And so literally the whole context itself will push us to behave the way we did prior. The important thing to realize is, as Ray suggested, some people do have young children, some people are in these various situations. And so it is really important, I think, for the leadership of those organizations to understand the psychological complexity of this and to say, hey, listen, we kind of want to think about our most cautious person here, at least for a little while, at least till we're really, as we suggested, the numbers really aren't where we want them to be yet. So for the next little while everybody eases into this, it makes a lot of sense to be sensitive to sort of the most cautious person among your team. And that's actually a way to kind of build the team, to really orient them around, hey, we want to work together. We want to show mutual respect. And we realize we're all in different boats. So the person that we really need to think about, let's think about them and let's make that part of our corporate sort of spirit during this time.
That, Raywad, if I can get you to pick up on that, that could be tricky because I'm guessing here, most of the time people don't organize their workplaces to make rules that take into account the people who are, at the opposite ends of the spectrum, right? They take into account the vast majority of people who sort of hang out in the middle. So how does somebody who's very nervous about the next several months, how do they tell their employer, look, I know you want me back in the office, but I'm not ready. And I know when I get back into the office, you sort of want me to act as normally as possible, maybe even not even put a mask on, but I'm not ready. How do people have that conversation?
Yeah, it's a good question, and it comes back to the survey that you cited recently. And my problem with that survey is the phraseology of the question. It isn't, are you ready to live with COVID? It's, are you ready to live with COVID given this and this level of government support, of state support? And one element of state support that can be offered is guidance to employers and workplaces on how to accommodate and whether you should be accommodating people who are challenged in this manner. So I think if we have a societal effort to normalize this conversation led from the government down, it makes it much easier. And frankly, why are we so eager to go back to 2019 normal anyway? 2019 normal is what got us into this. We should be looking at a new normal where mask wearing is acceptable for individuals who choose to, as we have in Asia for a long period of time, where staying home with you if you're sick is acceptable, where sick pay is acceptable and normalized. All these things that should be now invested in our society can make ourselves stronger and better prepared for the next pandemic, make us better than 2019 normal. And having the ability to have that conversation with your employer is part of that change.
So note to employers, we need a new normal, not a turning the clock back 2 years.
Yes.
Got it. Okay. Haley, I want to ask you about the survey that CAMH did, because you, I gather, did a survey where you asked people at various points during the pandemic how they felt about things. Why don't you just start by telling us how you conducted that survey?
We did the survey collaboration with Delvinia by asking about 1,000 Canadians, participants in the Ask Canadians panel, about a series of questions starting in May 2020. The survey continued. We did different cycles, 9 cycles exactly, between May 2020 and January 2022. Just to assess how people are doing. The intent of our survey starting in May, as we all remember, this was about 2 months into the pandemic or into public health measures. And we wanted to be able to assess how people are doing. The intention was to do it over the summer, but of course, the pandemic continued. We decided that it makes sense for us to continue to assess how Canadians are doing as the pandemic proceeded. So that's basically where we are right now.
Okay, as they say on Family Feud, the survey says, we're going to bring up a graphic here telling everybody what in fact it did say. This is from January of this year. 25% of survey participants reported feeling moderate to severe anxiety, which was higher than the 19% in the previous survey in July of 21. So the numbers are going up, which is not good. 24% reported feelings of loneliness compared to just 19% the previous July. 22% reported depression compared to almost 19% last summer. That's fairly steady. 24% needed mental health services to cope. Again, that compares to 20% last summer. So again, the number's going in the wrong direction. And 28% of respondents feared contracting COVID-19, and that's twice as high as last summer when it was only 14%. Haley, maybe you could pick up on that. You would think, in some respects, we're 2 years into this thing, and therefore we have a greater comfort level with how to deal with all of the uncertainty around it. These numbers certainly don't suggest that. Were you surprised at what you found?
Not really, because what we have found since the beginning of the survey is that the numbers fluctuate with wave of the pandemic. When case numbers are high, people tend to report more anxiety. And as the case numbers decline, then people seem to be better. There's some increases there. So there's just up and down sense with respect to how people are feeling. So in a sense, I was not surprised at the levels. What was surprising, however, for me, I should say I was not surprised that it had increased because of COVID. It was surprising that we were back at the level that we were in May 2020 with respect to anxiety and the other mental health measures that we had. That was surprising because, as you said, we have learned quite a bit over the last years. So were people able to adapt better 2 years in? But I think when we think about it, two things are important. The survey that's being compared was summer, and case numbers were much lower in the summer. There was a sense of optimism among people in the summer. So people will feel better. But we also have to remember December and Omicron And Omicron played a large part, I believe, in the numbers that we're seeing. It's a different variant than what we'd encountered before. And I think people were reacting to the swift action. Public health restrictions were put in place very quickly in December. And again, people's holiday plans were interrupted. The infectious nature of Omicron was much higher than before, and more people were very fearful of getting it. So I think in that sense, we take all of those things into consideration, puts the numbers in perspective.
I want to circle back now to something Rewat said several moments ago, which is the responsibility for risk assessment has in many respects now been transferred from the provincial health authorities to the individual. And to that end, therefore, Rewat, start us off here in a bit of a conversation about what kinds of things we ought to consider since we're now responsible going forward for making our own risk assessment. What do we need to do?
As noted earlier, you have to note whether or not you have someone to protect in your life. And if you don't, then 3 doses of a vaccine is good enough. It'll keep you out of the hospital and out of the morgue. And if that's you, like most people in Ontario, you're fine. You can go about your life with ease. The threat of a bad outcome for this disease is quite low. On the other hand, if you have someone to protect, or if you yourself are compromised in some way, if everyone else makes bad choices, you can always wear a good N95 mask and protect yourself in a very strong way. You can always make choices about not going to places with a lot of exposures, crowded places, or limiting your time spent in indoor settings. It always falls within the purview of your choice making on a day-to-day basis to limit your risk. Otherwise, get vaccinated. That's the number one thing that you can do to protect yourself and surround yourself with other vaccinated people.
Just on that front, do you think there are still people out there 2 years into this thing who have not yet been vaccinated, who are at this point still persuadable to be vaccinated?
I think so. It comes down to why they're not vaccinated. If it's fear of the mRNA vaccines, for example. Now we have the Novavax vaccine, which is not mRNA based, so they can pursue that one. As more data comes in, we can convince people of the safety of vaccination. As new vaccine formulas come out, we can roll out different tools. It's always worth trying.
Gotcha. Okay, Steve, I wonder what you would add in terms of now us being responsible for our own risk assessment. What do we need to consider?
It's really hard. That's frontal lobe stuff. Frontal lobes is where we do all our strategic thinking and our planning. It's been hard to do all through the pandemic because the virus is an invisible threat, right? And so we're kind of given numbers to kind of give us a sense of how much it's out there, but we can't see it with our eyes, other than potentially seeing people we know come down with the virus. And now that the numbers are down and we're getting these mixed sort of signals where politicians are saying everything's great and the medical community is saying, I don't know, the frontal lobes are quickly just being overwhelmed by the emotional part of our brain, which just wants to get out there. And really to hold that back, I sometimes talk about the frontal lobes as like the nanny holding back the 5-year-old emotional side of us. It's been doing that for 2 years, saying, no, you can't do that. No, I know you want to, but no, you can't. I think for most people, it's just like, shut up. I'm not listening to the frontal lobes anymore. I'm going to get out there. I'm going to do what I want to do, and I'm going to hope for the best. And we do all realize that we need to get to this endemic phase. We're being very hopeful that we're there. But I think all of us also, as we saw in those January numbers, that was when Omicron just came out. And when that hits us, a new variant that potentially could send us backwards again, that's when the real mental health hit kind of kicks in. And I think that's what you saw in those numbers. So that's the worry that many of us have, keeping our ear out for the new variant and hoping we don't ever hear about it. But I think that aside, I think most people are looking out the window and feeling, it looks pretty safe. I think I'll go for it.
And I should ask you the same follow-up I asked Ray, which is, who 2 years into this thing do you think is still persuadable to take a vaccine who has yet to do so?
Yeah, I mean, that is a very tricky one. And I think to some extent that's at the heart of some of the reason, we talked about elections, why politicians might be a little ahead of the curve on releasing restrictions. I think the other reason is we're seeing that division really, foment and become maybe even a more serious problem for our country than the virus is. And I think people just wanted to stop feeding, we all want the same place. We all want to get to a life where there are no restrictions. It was really really just a question of time frame differences. And I think, that's a big driver here, is that we want to reduce this divide we're feeling in our society that is so emotionally painful for so many of us, and will probably last beyond the pandemic.
And Haley, again, 2 years into this thing, is there any information you think we don't yet have that we need to have to be able to assess our risk more effectively?
I think the difficulty moving forward is right now, we don't have a sense of what the case counts are, because it's been really difficult to assess that since December with Omicron. So in a sense, it is difficult to know exactly where we are with respect to case counts. There are still some statistics that are available to individuals to allow them to make choices and determine their risk. But I think that in a sense, again, recognizing what we have experienced in the last 2 years, people can, to a certain degree, assess what impact being in a particular crowd might have, or going to a particular location might have, and where you are and who you are and who's going to be there. All of those factors impact, and whether or not you've been vaccinated and who you're going with. All those things will play a role, I think, in making decisions moving forward.
Ray-Watt, help us understand this, because, of course, as of the 1st of this month, vaccine passports are no longer necessary to be shown if you go into most typical establishments. And yet some businesses have already put on the record the notion that they are going to continue to ask for them. Why do you think that is?
It could be a different kind of understanding of limited science, or it could be an understanding that their customer base is comfortable with vaccine passports. I think it's more likely the latter. I'm getting emails from business owners asking about this, actually. And I think what they feel is if they remove that requirement from entry into their venue, it will keep people away who are afraid of exposure. The vaccine passports have actually done a remarkable thing to encourage people to patronize some businesses because they feel safe in that environment with that veneer of public health protection. Remove that veneer and you may see some bad outcomes.
Well, let me check with Haley on that. Did your survey give an indication of, let's say, how frontline workers feel, how vulnerable or safe they feel, if you're wait staff or that kind of thing? Did you get that number?
Our survey found that individuals whose job placed them at high risk of getting COVID, of course, they were more likely to be anxious. They're more likely to experience anxiety symptoms. They were more likely to be worried about getting COVID. So yes, our survey indicated that, of course, that was completely reasonable for individuals to assess their risk of getting COVID and how that would make them feel, meaning greater anxiety, greater worries.
All right. In our remaining few moments here, I want to start by asking Ray-Watt the following, and that is, I don't know, what I'm gleaning from this conversation is that most people in society seem to be ready to try to get things as back to normal as possible. And that's certainly the impression you three have reflected personally in our conversation here. My question, Ray-Watt, is what if later this year we get hit with another wave and another variant? What does that do to all of what we've been discussing?
It is an excellent question. And I know that Theresa Tam recently said that we need to be able to pivot to reenact some kind of public health response, but with a lighter touch. And I think she's right. We can't have the heavy touch we've had in the last couple of years. People will not tolerate it. As I've said already, public health is the art of the possible. If the public is not on board, it's not possible. No one's going to be on board with economic closures, with school closures, with the kinds of restrictions we saw the last 2 years ever again. So we need to put into place the infrastructure to have a more lighter, more high impact public health led response. We can do that starting now, invest in things like surveillance, vaccine platforms, better information sharing resources, that sort of thing. We can do it. It just takes planning.
Steve, what would you add to that?
Yeah, well, I'd echo a point he made earlier, which is we really should link these restrictions or these decisions to data, and maybe just hospital numbers, nice clear data patterns, and just not make it so much a personal decision or whatever. Just say, hey, hospital numbers hit this level, this is what we're going to do. If it hits this level, this is what we're going to do. If we all behave as well as we can try to prevent those things from happening. But I think we need to get the personality out of this and make it much more data driven. But yeah, I think if we do get hit, every time we get hit, we lose a sense of empowerment. We start to feel like we can't control things as well as we'd like. And psychologically, that takes a toll on us for sure. So I think we do have to be ready ready for it to come. We have to sort of mentally know this could happen. And this would be a nice cool-headed time to talk about, okay, what would trigger certain things when they aren't really staring us in the face yet. So we could kind of talk about it in a cool-headed way, and then watch those numbers and let the numbers dictate what we should be doing rather than the politicians or whoever else.
I wonder if we live in that world. Anyway, I want to thank the three of you for joining us on TVO tonight. That's our time. From right to left on my screen, Steve Jordans, Ray-Watt Danand, and Haley Hamilton. It's great of all of you to spend some time with us on TVO tonight. As my dad likes to say, stay positive, test negative. Thanks, everybody.
Thank you.
2 years ago, many of us had never even heard of a coronavirus. But global public health institutions such as the Centers for Disease Control, the World Health Organization, and the Public Health Agency of Canada certainly had, and they were springing into action. Now, as we approach the second anniversary of the onset of the worst global pandemic in a century, what did those big players get right, and where did they go wrong? Let's find out and ask. In Washington, D.C., Lawrence Gostin, University Professor in Global Health Law at Georgetown University and Director of the World Health Organization Collaborating Center on National and Global Health Law. In Montreal, Quebec, Dr. Joanne Liu, Professor at McGill University School of Population and Global Health, where she's the Director of the Pandemics and Health Emergencies Ready Lab. And in the Bloor Court neighborhood of Ontario's capital city, Mario Passamai, who was a senior advisor on the SARS Commission and is currently a consultant in occupational health and safety issues. And we're delighted to welcome you three to TVO tonight for a conversation that I guess it's okay for us to have now, given that this pandemic is almost 2 years old, certainly enough time to start looking back and learning some lessons. And to that end, I want to start by just reading this excerpt from the Washington Post science and politics writer, Joel Aschenbach, who wrote the following. Officials with the World Health Organization could have been faster to declare a public health emergency of international concern. They punted on that on January 23, 2020, citing the absence of confirmed cases of human-to-human transmission outside of China. A week later, they acknowledged the obvious. We were all in trouble. At that point, the virus had seeded itself in 18 countries. Okay, Lawrence Gostin, get us started here. Could our global health institutions have prevented much of what we have experienced over the past 2 years, in your view?
Probably not. Having said that, I do think that China misled the World Health Organization, saying that there was not human-to-human transmission when there clearly was widespread community transmission. And at the same time, I think the WHO amplified that incorrectly. So there are a lot of lessons to be learned. It was our only shot to keep this epidemic under control, but probably we would have still ended up in the place we are now because it's a fast-moving respiratory virus.
Joanne Liu, what's your view on that?
Well, I think that we got a little bit, I would say, sidetracked by some of the geopolitical tension back then. That's one thing. And the other thing is, as well, is there might be some delay in terms of calling for public health emergency of international concern. But I guess the biggest delay that happened at the beginning of this pandemic is what we call the last month of February, when we declared the public health emergency of the international concern, and very few countries actually started to take any measure about, I would say, responding to this epidemic. And so therefore, nothing happened. So last month of February, and then finally declaration of a pandemic on March 11th.
Mario Passamai, what's your view?
I think it could have gone much, much better. I think the great failure of the WHO and our own public health agencies is that between SARS-1 and the advent of the pandemic, we had a golden era of research into aerosol transmission that revolutionized how we understand that respiratory diseases are spread. But all that knowledge, all that information was ignored by the agencies leading up to COVID. And then once an emergency was declared, they were so slow in implementing airborne mitigation measures. So I think that's a real institutional failure, and things should have gone much, much better.
All right, well, let's look back. SARS was, oh gosh, how long ago was it now? 2003, I guess. I want to look a little bit further forward from that because, Joanne, in your previous role, you were international head of Doctors Without Borders. You were overseeing one of the infection outbreaks which preceded COVID. And in this case, I'm talking about Ebola in West African countries. This would be around 2014 now. And I wonder, in your view, whether institutions such as the World Health Organization or the Centers for Disease Control, did they effectively make a difference in that case?
You mean in that case in Ebola?
Yes.
Right. I think in 2014 has been the acid test for WHO in terms of responding to, I would say, a fatal regional epidemic. And then back then, I think that they were very slow. Then although we complain about this pandemic of declaring the public health emergency the national concern, with Ebola, it took 6 months. With COVID-19, it took 6 weeks. So just to keep things in perspective. So I think that in Ebola time, WHO was very slow in terms of admitting that there was this out of control epidemic in the region of Western Africa, and as well in terms of ramping up and then helping in terms of the response. So this is what they were missing in terms of being the convener, in terms of alerting, in terms of making sure that the world was giving a hand to get the Ebola epidemic under control back then.
Okay, that's good perspective to have. Mario, how about when it came to SARS in 2003? How either better or worse did those international institutions act in that case?
Well, WHO was problematic for Canada during the SARS-1. It clamped down. It imposed an outside quarantine, if you will, on Canada and travel to Canada. And I think that there was a real disconnect in terms of communication between Canada and WHO. And I think that's one area that was fixed after SARS. I think that what wasn't fixed was that SARS exposed a real institutional lack of capacity to study disease transmission, both at the WHO and in Canada. And that was not addressed. And I think that's a failure that needs to be addressed now, I would hope.
Okay, Lawrence, with these two historical examples now part of our understanding and part of the historical record, do you think the World Health Organization, as an example, had the powers it needed to act appropriately to protect us as best it could as it relates to this coronavirus?
Clearly not. In many ways, the world has the WHO that it deserves because it's not given them political backing. They've been in the middle of a geopolitical struggle, particularly during COVID with China and the United States. We haven't given them the powers that they need, that even though after SARS-1, the international health regulations were revised, we still didn't give them the powers that we clearly needed in this pandemic. And then, as Joanne says, after Ebola, which was an utter failure, there were reforms at WHO. There was a new health emergencies unit, which has really been performed, I think, quite well. But again, we haven't funded them very well. And so WHO is starved of funding. It has the funding of about the size, or probably a little less than a large U.S. teaching hospital, 1/4 of the size of the U.S. Centers for Disease Control and Prevention. And we really need to do a lot better in providing political support, legal powers, and financial sustainability for the World Health Organization. Until then, we're going to continue to have a weak WHO when we need them most.
Joanne, I noticed you had a big smile on your face at the beginning of that answer, but it didn't seem to me like it was a smile of happiness. What was that smile about?
No, I think that Lawrence is quite right. And I think that WHO is being undermined throughout, and it remains undermined. And this is why they're not able to do their job. And the reality is it really is suiting people to have a WHO is not empowered and not strengthened. And the reality is we all pay for that. So that being said, I think that in terms of operation, I think they has dramatically improved. But I think where we need them, and this is what we were alluding beforehand, was we need them, what they are mandated for, which is not as much to be operational, but to be able to give norms and guidance when such epidemic happen. And this is where I think that in this particular sequence of COVID-19, they were like the other guest said, they unfortunately did not enforce the fact that they were aerosol and to mitigate and take the real measure with respect to that. So this is what is unfortunate. But just to say something positive is the legacy of Ebola, which has been massive, and we tend to forget, is the fact that we follow through with what we call the WHO R&D, Research and Development Blueprint. And because of that, we put some sort of clear rule about how to do discovery for new vaccine or new treatment. And it was about open source sharing and about doing clinical trials during the time of pandemic or epidemic, things we were not doing before Ebola. And we did that for COVID-19. And this is something that probably has helped us to be better, I would say, a tool to answer the pandemic.
Lawrence, maybe you could help me understand something which I suspect many of our viewers don't get right now, which is this, well, I think Joanne described it as an undermining of the World Health Organization. Why would countries want to undermine the mission of the WHO during a time of a once-in-a-century global pandemic?
Yeah, I mean, the question itself is jaw-dropping, isn't it? Why would they? And I think part of the reason is that we've devolved toward populism and nationalism. It's my country first. It's me first, rather than my community, my country, my world. And you had two, strongman leaders, Xi Jinping and Donald Trump. Probably Donald Trump may have been even worse, that were using WHO as a football. At the time, President Trump actually sent a letter to UN Secretary General Guterres giving notice that the United States would withdraw from the World Health Organization. At the time, I wrote in the Washington Post that it was the most ruinous presidential decision in my lifetime. And of course, President Biden, on his first day in office, reversed that. But, your question answers itself. Why would any country want to do that? And I think it is because of populism and nationalism. And I want to turn back to something, that we talked about with SARS-1, which was the travel bans against Canada. We've seen this. We saw it in Ebola, and it was very unhelpful in West Africa. And we've seen it in spades with COVID-19, most recently against Southern Africa, for being transparent, for being brilliant scientists, and they get punished for it. And that's happened throughout the pandemic, and it's inexcusable.
Well, Mario, since we're back talking about SARS again, let's talk about the Public Health Agency of Canada, which of course we hear from pretty much every day now during this coronavirus crisis. Was there such an organization back in the early 2000s when you were dealing with SARS?
No. The Public Health Agency of Canada arose from SARS and was based on recommendations from Justice Archie Campbell, who headed the SARS Commission. But a real problem was that what Justice Campbell recommended was that the agency be multidisciplinary. That is, it include infectious disease and epidemiologists, but also engineers, bioaerosol experts, physicists, all the disciplines that we need to understand pathogens. And that was not done. And I think it was not a fatal flaw, but a very serious flaw, and one that has emerged during COVID-19 as being a real problem for our response.
We'll follow up on that if you would, Mario, because if we got the Public Health Agency of Canada as a result of SARS, when the coronavirus hit, we're talking now either December, or I guess January 2020, and then March it's official, what was its mission, or what should its mission have been in those earliest of days, given that it was now dealing with a global pandemic?
Well, it decided right from the start that this was not an airborne disease. It ruled that out. It should have kept an open mind. And there was during that time, there were Chinese scientists and doctors who were writing articles in the Lancet saying, "We believe this is airborne. We have gone to airborne precautions. You should consider it too." There was also the fact that China on January 20th had itself gone to airborne precautions and deciding that the large droplet precautions that the WHO was recommending were no longer effective. But the Public Health Agency of Canada ignored all that and decided that this was not an airborne disease, and when they should have kept an open mind. And I think that was just a very destructive, troubling decision that has really hampered our response. And I think it's led to things like lockdowns being the only effective tool, when in fact we had many, many other tools that we could have used and should have used.
Joanne, do we have any better understanding 2 years later of why the Public Health Agency would have made that decision?
I don't think I can offer an answer to that, but I think it's very unfortunate because we're still paying the price today of not basically adjusting our measure as we are actually easing the different public health measure. And so not recognizing the very basic contribution of aerosol in the transmission of COVID-19 is such a huge mistake. And as we are right now, taking off masks everywhere, including in the school after the winter break, that's going to be very problematic. So I think that if we want to make sure that we are able to coexist with the COVID-19, we need to acknowledge and enact updated measure with respect to aerosols.
All right. Having said that, Lawrence, once we did figure out, not we, once the experts, once they all figured out that it was aerosol, how quickly did they adapt to this new information and rethink their strategies for the world essentially taking it on?
Yeah, well, you go back and you look at the early days of the pandemic, even after a year, it wasn't just the Public Health Agency of Canada that was slow to react. The World Health Organization itself didn't really fully recognize aerosolized spread early on, neither did the US CDC and other public health agencies. But even after we knew, we've had awfully difficult times with basic infection control measures like masking, social distancing, occupancy limits, business restrictions in terms of going to restaurants and things like that. And if you had to pinpoint one clear vulnerability in the countries that performed least well, like my own, the United States, it would be a lack of trust in government and a lack of trust in your fellow citizens. And so what we've really seen in North America, Europe, and others is the culmination of, what I like to call kind of me. Everybody's asking the question, what are my rights? What does government owe me? And we've stopped asking the question, what do we as a community, as neighbors, as a country, owe to our fellow citizens, owe to our fellow global citizens of the world? And how can we make a difference for the common good? We've lost that tradition of the common good. And I think it served us really badly during COVID-19. How we recapture it is going to be very difficult, but we must.
Well, you've asked the question, and I'd love you to follow up on it right now. Do you think that, given the political times in which we live, do you think these institutions can do anything to steer themselves into positions of greater trust with the electorate?
Well, we need to have much clearer messaging. There's been really confused messaging from, governments around the world, particularly even from the US CDC, which has really been in the past, a crown jewel among public health agencies. The World Health Organization has also failed in that regard. But ultimately, I think, it's not these agencies' fault. They've tried hard. They're scientists. They're dealing with scientific uncertainty. The problem is that, our societies are crumbling. You could see it with the truckers' convoy in Ottawa and the rest of Canada that spilled over to the rest of the world. You can see it in the kind of political division and hate. I was really taken aback at the CPAC convention, the conservative convention in Florida the other day when they mentioned Justin Trudeau, and I don't think Justin Trudeau has done it, everything right by a long shot, but he was booed, and it's just a question of the bitter rancor that we have in our political communities, and how we end that. I don't know. I think it's going to need somebody that really is a healer, and we just don't seem to have that at the moment.
Well, Mario, I gather that's some of the reason that people have lost faith in these institutions is that they have felt that, well, I guess a couple of things. Number one, they haven't really understood the recommendations that have been suggested. The recommendations, as Lawrence just suggested, have suffered from communications problems from time to time, conflicting advice offered as well from time to time. But the other thing is this notion that these groups can sort of operate in unaccountable space. So let me ask you about that. To whom are these organizations ultimately accountable?
Well, they should be accountable to their stakeholders. And here in Canada, that's been a real gap. We don't have accountability. We don't have transparency. We don't know how decisions are made by the Public Health Agency of Canada and other agencies. It's like the old sausage making, it's all done behind closed doors. So, we don't know why they decided to rule out airborne transmission way back when. We don't know why they continue to say that this was a drop of disease long after most everyone realized that it wasn't. And they've done some really goofy things. For example, not that long ago, I had to go to take a family member to a hospital. I had my N95, and I was asked to take it off. And afterwards, which makes no sense, they said you can wear your N95 if you put a surgical mask on, which again makes no scientific sense. So there was a study in 2014 by the Canadian researcher Lida Bourabov of MIT, which showed that the 2-meter rule made no sense. And yet everywhere you go, they tell you to stay apart 2 meters. So, part of the problem is that our agencies have brought it on themselves. Lack of accountability, lack of transparency, and lack of keeping up with the science. And we really need to change that, possibly through a national inquiry and possibly through other ways to hold them accountable and transparent. So big decisions like deciding that a disease is not airborne should be the subject of legislative hearings where there would be other experts, and people should be able to see how exactly these decisions are made.
Mario, when you told that story about going into the hospital and having them force you to take that N95 off so they could put on a lousier mask in its place, Joanne smiled, Lawrence smiled, I smiled. I'm betting everybody who's watching or listening to this right now has had that same experience where you walk in with a high-quality N95 mask and they ask you to remove it so you can put on this piece of cloth that is worse, but they hand you with a pair of tweezers. I don't get that either. But okay. Anyway, that aside, Joanne, if there is another pandemic, or maybe I should say when there is another pandemic, do you think the World Health Organization will be able to stand up to the next bit of political pressure, whether it comes from the United States or China or whoever? Have they learned enough from the current circumstances to be able to act differently in the future?
Well, just to echo what Lawrence I said, I think it's going to be very, very difficult unless we really decide to make them able to face the music, meaning to finance them and to give them sustainable financing. And if we don't give that, then that's going to be very hard for them to be independent in terms of being able to communicate what they know in real time, being able to do investigation when there's a new emerging pathogen, like they haven't really been able to do in China. So if we want the WHO that we dream for and then we hope for, then we need to as well put the money that is necessary to make them reach that level of competences and action. And so I think that it's going to be difficult. That being said, is I think that everybody has learned so much through this pandemic, and I think that we all have grown in it. So that would be, I think that we are, I would say, slow learner on few things, but I think we still learn. But I think as well, it is key and I would say fundamental that we try to avoid what I call the double fault of not being prepared and not learning. And then we need to continue to be able to do independent investigation on those different bodies that are basically running the show when there's a public health emergency of international concern. And so if we don't do this sort of pause and reflect what went well and what went wrong, then that's going to be difficult. And then my biggest, I would say, issue now is that we basically go into what I call rush into a collective amnesia of what happened and just move on and not do this exercise of a postmortem to learn the lesson to be learned.
Well, our slogan here at TVO is never stop learning. And it sounds like you're saying that's pretty good advice for these international health institutions as well. And with that, I want to thank Lawrence Gostin and Dr. Joanne Liu and Mario Passamai for joining us on TVO tonight. Thanks for sharing your views, you three. Be well, stay safe, and hopefully we'll see you down the road.
Thank you.
Thank you.
And that is the agenda for Tuesday, March 1st, 2022. Tomorrow, we'll turn our attention to Russia and its brutal and unprovoked war against Ukraine. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.